Hi, and welcome to How Humans Heal. I'm Dr. Donnie Wilson, and today I'm introducing you to Dr. Roseann Capanna-Hodge. She is an integrative and pediatric mental health expert, and she is founder of the Global Institute of Children's Mental Health, as well as Neurotastic supplement line. Thank you so much for joining me here today, Roseann.
Well, Dr. Donnie, I always love talking to you, and it's as educational for me for us to have this conversation as hopefully for your amazing listeners.
Oh my gosh. Well, and I feel like this is such an important topic. I really always am super compassionate about people who are experiencing anxiety, depression, and other mental health issues of all ages, right? From children, teens to adults, during pregnancy, postpartum, everything in between, because especially we all just came through this very stressful pandemic. And now every day is a new day and it's new stresses. And as you know, I love to help people with stress recovery. So this is really important to me. But tell us a little bit like your background and, why are you so passionate about helping people with their mental health?
Yeah, well, first of all, this is my third decade in mental health. I'm super happy to say that. And I have actually always been a holistic practitioner. And how I got, inspired, or I should like to say, called to this work is actually at 5 years old. My mom's friend asked me what I wanted to do. And I, out of nowhere, said I want to be a psychiatrist. And then I realized later that psychiatrists are pill pushers. So I changed it to psychologist. And that's really my story. And along the way, I made sure that I, volunteered and did internships and did all of these things. And I really found my passion in working with kids and families because I felt so empathetic towards them. And, people will do more, parents, adults will do more for their kids than they do for themselves. And kids and their struggles, they have such a resilient brain. And so when we do things for children, they're much more likely to absorb those changes, take them on, and have a lasting difference, right? And it's never too late to take care of your mental health, right? I've treated people in their 80s that never went anywhere. For the first time, they came to me. But when it's a kid, right, their brain is primed for change. And it can become, as much as it's a painful point, it can become this beautiful recalibration for a family, right? Like my kid is struggling with focus or anxiety or OCD. I deal with really complex cases like Hands and Pandas, suicidology, depression, all of these things. And when there is a struggle, and my cases are parents realize that psychiatric meds and traditional talk therapy just isn't working, right? Most of the time, that's my cases. Then they go into science-backed natural solutions. And it becomes this aha moment like, wow, we all can benefit from this. So it really becomes, as I always say, lotuses bloom in mud, right? So it's this terrible storm. Nobody wants to see their kids suffer, but most families then start to implement these lifestyle changes that help their families to thrive. So that's been the inspiration of my work is stopping people from going down rabbit holes and going right to the science of natural solutions and integrating those changes. And that's my whole life work, and it will continue to be life's work.
Oh, I love that. And you've written several books now, including the most recent one called It's Gonna Be Okay, and where you share these insights. I mean, and I think it's so important what you're saying is that, and I think a lot of people listening will relate that, of course, there's the mental health system out there and there's medications, but a lot of times parents are realizing, hey, that my child still doesn't feel well, or I don't really want to just be relying on a medication. What else is there? And I'd love to, this is where I really look forward to connecting with you about some of these other alternatives, just so people listening know, like, yes, there are other, and as you're emphasizing, there's actually science behind this. This is not just like something that might work. This has actually been researched. And as you've said, you've been using this in your practice for decades now. So talk us through, like, what does that look like when a patient comes to you, say it's a parent bringing their child in for anxiety and maybe, focus issues at school. What does that look like, and what is the path you guide them down?
Yeah, and the anxiety focus combination is a common combination, not just for kids, for adults. And, what winds up happening is parents medicate their kids, right? Because they go to a medical provider or a mental health provider, and that's the path that is put in front of them. And you don't know what you don't know until you know, right? And so, we don't realize there's so many ways to change neurotransmitters, to actually change the brain, right? Change the structure and function of your brain. There are ways to do that. And in my book, It's Going to Be Okay, I have 42 pages of research citations. So I don't mess around. This is what I've been doing because since I've been doing this for 3 decades, I've gotten pushback. And so, and plus on top of that, I want people to see the research. We really want to talk about what's actually working. And 70% of the time, or medications are given to children, what's called off-label, right? It actually, things like Miralax. Do you know Miralax is not recommended for anybody under age 17?
Wow. And yet it's recommended all the time.
Right. Yeah. So people come to me and they typically have tried like an ADHD medication would be the most common. And what are they saying? So 100% of the time on an ADHD medication, according to research, you're going to have a side effect. 100%. 3 most common: irritability, sleep problems, and eating disorders, restrictive eating, right? So, and
now it's snowballing into another health issue.
Bingo, bango, my friend, Dr. Donnie, because what happens is you stop eating, you're going to get nutrient deficiencies and your brain's going to go down. So the thing about whether it's ADHD, depression, anxiety, whatever it is, we have the brain and we have behavior, right? I've created this program called Brain Behavior Reset on purpose, right? Because we all think a magic pill, and please, I'm not shaming anybody. This is just an education point. Your doctor says, here, take this pill. Your kid's going to be more focused, but who's teaching them a different behavior? Who's teaching them something different? We are not empowering parents for the right verbiage, the right tools, the right way to shape behavior. And then they feel terrible. Then they feel like so anxious, right? And this is my common thing that happens. People come to me. My kid today had somebody call me and say, a friend of mine said, my grandson is failing 3 classes. It's his senior year. We're pooping in our pants for college. I was like, okay, that's good. Then I had another friend of mine call me and she was like, what do I do? He is really struggling with anxiety. In his freshman year of college, we've already pared down the classes. She's like, I signed him up for counseling and I found this neurofeedback provider in that state. Would you check it out? And I was like, awesome. So we made plan A, we made plan B. So typically there's some type of crisis, right? And on more and more people fly in all over the world for me. And a lot of times people come in for an intake in person. But I also can work fully virtually as you do with people. And they sometimes just are like, I don't want meds. I want my kid's brain to be like a Ferrari because the kid is a Ferrari. I'm like, yeah, the kid's a Ferrari. So what are the tools that we use? So I always start with what's called a QEEG brain map. And a QEEG brain map gives us a visual representation of the health and the functioning of the brain. It tells me what's happening over the structures and in brain communication. And in simple ways, it really tells us what's overworking and underworking in the brain. When we know that, we can say, oh, well, that's corresponding to anxiety. Oh, for example, I have somebody who has chronic Lyme disease and she's an adult. And she has been doing neurofeedback with me, which I'll talk about. And I'm getting her anxiety down very slowly. She has a lot of activation. And so we then did the second brain map and I'm like, this isn't moving fast enough for me. And she's not an impatient person. She's done like 10 years of different treatments. Her Lyme has been very treatment resistant, and she's a great provider. And so then I was like, look, this is what we're doing. Every single symptom you have points to one region in your brain. We are going to train that one tiny little spot to not be so darn anxious. And everything else should get the message. And so I saw her today and she was like, it's working. Like, I'm feeling a lot better. And I was like, oh my gosh. So neurofeedback is one tool. There are many tools, meditation, heart math biofeedback, PEMF, and more devices are coming. So my magic is calming the brain, teaching new behaviors. And it doesn't have to be just my magic. It could be your magic, because that is what happens when our brain is so activated and in a fight, flight, or freeze. It is not possible of thinking. It is not possible of taking action differently. You get real stuck, same behaviors over and over. And these tools are amazing, Donnie, because, for, like I said, in our program, we start with this brain map, which gives us a real clarity on what the actual issues is. I think it's ADHD. My, friend today, her grandkid, she was like, I think it's ADHD. And I was like, honey, when I listen to you, I hear learning disability. She's like, oh yeah, he's got that too. And I was like, no. I hear learning disability first. I was like, forget about us guessing about it. We're going to get a brain map and we're going to figure out what's going on. And we'll decide, like, is he eating appropriately? Like, what is that well-rounded lifestyle that's going to help support the brain? And I think that's what the people here that are listening, right? Your people are on exploratory journey, but there's so much we can do to get the brain working completely differently, and not like ADD meds where you take it and it only works if it works when you're on it. We're really talking about rewiring the brain so that it works differently.
And that's like big piece of the message is just realizing that the brain can be rewired, that there is such a thing as neuroplasticity, and the nervous system can heal. And I love your point. It's so true. Where we get so stuck in stress mode, it's very hard for the nervous system to heal. It also for children in stress mode. And I'm seeing way more kids all the time, and of course, because of the pandemic and even since then, that are in that fight or flight survival mode. And it's like, then of course they become more susceptible to infection.
Of course.
More susceptible. So then it just snowballs. And then as a parent, you're like, what am I supposed to do? How can I help with this? And to just, first of all, know that it's possible for the nervous system to heal. And I would love to, get your input on this concept of neuroinflammation, because of course, for a long time, a lot of these mental health issues that you've just been naming, we thought of it as like, oh, there's like something wrong with the neurochemistry, and people would be led to think that they can't do anything about it. First of all, it's just stuck that way. So first of all, we're saying that's a myth. There's absolutely things we can do to rebalance neurotransmitters and help the brain heal. And then the next thing is to say, it's not just about the neurochemistry, it's about inflammation in the brain, right? And how that inflammation that is a secondary usually to the stress exposure then just perpetuates it.
Yes. And, we are learning so much about neuroinflammation. And, what I want to say, and I hope this resonates with people, first of all, stress creeps up. We've made it like we're in a society where we have a level of acceptance. Like, oh yeah, stress is there and everybody's got it.
We normalize it, right?
We normalize it. And you still have to do things to counter it. You do. Otherwise, it's going to show up as a mental health or physical problem. There's no way around it. That's just what's going to happen. Yep. And so with kids, we're like, why is my kid stressed? Like, people come to me and they say, well, they're going in good school and they're, living in a nice house. Why are they stressed? Well, you got an empath maybe. Maybe your child is picking up on the world, right? Before the pandemic, 1 in 6 adults on a psych med. Right now, we can't even call it post-pandemic, but pandemic, 2023, 1 in 4 on a psych med, right? We know that 50% of kids have a mental health problem, of children diagnosed with a mental health problem are not getting treatment. 50%. So
Wow.
they're living in this intensity, like, you have to counter it all the time, right? And, highly scheduled kids or just so much that goes on. And it's the compounded low-level stressors or mid-level stressors that really can pull a nervous system down. And so we have to start realizing, wait, what am I going to do? How am I going to address this? And even though many times we can only connect the dots, right? When we look back, there are signs. And those signs are like belly aches and headaches and avoidance and maybe crabbiness. And it runs the gamut of, across the board. And I think that's really important because nobody ever regrets getting help. They only regret when they don't. But talking about neuroinflammation, so I do these brain maps and you can see inflammation pretty
That's
clear.
amazing. You could just see it. Then you know it's there.
You know it's there.
Down.
And the scary stuff, Dr. Donnie, is I almost never have a kid who doesn't have inflammation in their brain, even more than adults do. Like the amount of exposure and high level stress and moms being stressed when they're pregnant. And please don't feel bad because we can counter it. And there's always ways to rewire and don't think that. And it doesn't matter if your problem is genetic. It doesn't matter if it's inflammation. It doesn't matter if it is stress.
Because we can help in all of those.
Help. And there's paths of treatment. But psych meds and talk therapy and therapy is very important when your brain is regulated enough to do that work. If you need cognitive behavioral therapy or, other forms of therapy, we do a lot of work with OCD, which a lot of people don't do. But you have to have a brain that is, the inflammation has to be lower. So how do you achieve that? And I think that's the part where people struggle way more with, the prescriptive part about what I do with neuroinflammation, right? So if it's infection related, you've got to address that. Well, if it's dietary related, you're eating typical, a SAD diet, a standard American diet, or you're really restricting, you're eating a lot of kids because they're anxious, suffer from sensory restrictions or even something called ARFID, which is related to food avoidance because of the sensory experience. It really becomes hard to get in nutrient-dense food. Not impossible, but hard. And it really requires a step-by-step methodical approach. You can't just let your kids eat chicken nuggets and French fries and think, yeah, they're going to, not have high levels of stress. And that neuroinflammation, the brain inflammation, infectious disease, there is this bidirectional influence, right? So the more stress you have, the more likely you have infections. The more infections you have, the more inflammation you're likely to have. So, but stress is way more impactful on a physical and a mental health level than I think people are really willing to admit or maybe understand.
Are you ready to discover your unique stress type? We're all affected by stress, but why fight it when you can master it? Take my free online stress type quiz today and conquer your burnout. We'll measure your energy, sleep, mood, focus, and body to determine how your body is built to deal with stress. Then we'll work together to take precise action to help you get out of stress mode and become resilient to it. It's time to master your health. Let's go. Yeah, it's so true. And I want to go back to talk about neurofeedback a little bit, just so people really understand what is it and what does it involve? Like, how does that work?
Yeah. So thank you. And so there are different forms of neurofeedback. And even though my field likes to, say this form of neurofeedback is better than this or whatever, they're all great. They're all, FDA regulated. You can't get a device unless you're, a professional. I do EEG neurofeedback. And EEG neurofeedback, for me, why do I do it over others? Again, it works for my population. It's much more controllable. And my brains and the kids that I work with and adults tend to have complex situations, and I need something really controllable. So really simply, what is it? So it's technology that's been around since the late 1960s. Yes, late 1960s, got really popular with the advent of the personal computer in the late 80s, and really has just taken off and has tens of thousands of research studies, over 3,000 peer-reviewed studies. So what it does is it provides, the computer gives reinforcement to the brain for producing a healthy combination of brainwaves. So in my situation, you get a brain map. Dr. Roseann makes a protocol. That's what I do. That's my jam. I'm kind of like a savant on brain maps. I freak people out. I've been accused of having listening devices in their house. No lie, because I have that unique position where I've done so much with the brain, and I'm such an expert in kid behavior. And the brain tells us if this area is overworking, you see it. So if this area is overworking, you can't do this. This is underworking. Then you're struggling with that. Like, it's just the way it works. So it gives a real clear pattern. You also can see, because I've done over 10,000 of these, I can tell who's got a gut issue. You can see that inflammation. You can see, you can even see the impact of COVID. So I make the protocol. And what does a neurofeedback session look like? So if you can visualize, you're hooked to a computer, and we do it remotely as well as in the center. So we can mail people equipment, mostly in the United States. Some other countries have the same power grid as us, has to be 60 hertz, or it won't work. So other countries, like we have somebody in Mexico right now, it works, some of the Caribbean, but my bestie in New Zealand, sorry, Shelley, you can't have it. So, but you're hooked to the computer, it's measuring, it says, oh, look, Dr. Donnie is producing the exact healthy combination of brainwaves, and your brain will, within 2 to 3 seconds, want to get reinforced for producing this combination. What is the reinforcement we use? So we use auditory, so there'll be dinging, sometimes other sound, and then it's playing a movie. So you're getting a visual feedback or show, and 2 to 3 seconds, that brain says, oh, every time I push down this really anxious brainwave, this movie plays. So it is training you like a gym workout, 2 to 3 sessions a week. Most people are doing a couple sessions over like a 6-month period. You're certainly almost never doing less than 20 sessions. It would be very rare. And it's for people ages 3.5 and up. It's good for a variety of clinical conditions, lots and lots of research with ADHD, anxiety, learning problems, mood, pain, and drug addiction. It's actually very, very much used with drug addiction and trauma. I did a lot of work with 9/11 and Sandy Hook survivors. And I've always had such a privilege to work with people with trauma, because it helps to regulate without such an activation. So hooked to a computer, getting reinforced, the brain changes itself. Changes are lasting. Research as far as 10 years out show that not only are the changes sustained, but the brain actually continues to get better on its own. It's pretty cool stuff. I mean, if anybody's ever hung out with me and a learning capacity, I freak everybody out because I can just do so much so fast. It's 100% because of neurofeedback. I mean, I'm not saying I'm not an intelligent person, but it has allowed me, it's like being able to have 20 million tabs open in your brain and be completely present. Like, to get to some of that higher levels, you don't have to have a clinical problem, by the way, to do neurofeedback. You can do peak performance brain training. So it's a great, safe, it's easy. Sessions are typically under 30 minutes. And I waited about 10 years for the home-based equipment to get as good as it is. And you want to have a certified provider. You don't want to go to some janky place where somebody's not certified. Every once in a while, people can find equipment on eBay and get it. You want to have somebody who has real expertise in your area. If you're anxious, go to an anxiety expert and work on your behaviors too. Don't just think a regulated brain is going to know what to do. You got to find ways to replace it, right? We can all want to drive a car, but you still had to take the class, right?
Yeah. Yeah. And that's the thing is, like, I really, I'm always saying to patients, if, we can be resetting the signaling even for cortisol and so on. But if your environment keeps on re-triggering a stress, then it's going to get confused.
That's right.
Right? It's like,
Oh, I mean, so well said, right? You can do all you want. You can take your bath, you can get your massage, you can do that. But if you're still in the same stuck place, right? You have poor boundaries with others, and you're getting triggered all the time by a difficult family member or whatever, and you're just doing, or you're cruel, you're rough on yourself, right? You're the same negative thoughts all the time, all the time, all the time. How is your nervous system going to recover? It's not. So, it's an opportunity to change and do things better for yourself. And that's the beauty. Like, a lot of times my moms in particular are like, I'm in here for Joey, and Joey's going to get better, Dr. Rowe. And then maybe I'll take care of my own anxiety and come off the Prozac, and I'm like, okay, well, you're going to see how much better he or she is. And at the next meeting, it's you're coming in. Okay. And usually when the stress levels come in, but we have women in particular, I mean, we just are, fed a whole line that we're super women, and we're not. And we have to learn a different way to manage. And we can be wonderful caregivers and friends and mothers, but we also have to take care of our own physical and mental garden. We really do. And we're role modeling that for our kids. So I'm going to give you mama guilt if you're listening. So if you're not role modeling the good stuff, you're sending a message to your kid that's not good. So if that's the thing that's going to make you take care of yourself, fine. But take care of yourself too.
No, and it's so true that we see that when parents are more regulated with their nervous system and feeling, out of that stress state into a more calm state, then it helps their children to recover. And because we, as humans, we're in proximity and connection with each other, whether we realize it or not, and we're going to affect each other. And so it's more like looking at it as a family unit. What do we need to do to help everyone heal and recover versus, just the one person, right? Like, and I love that you're saying, like, for women to be like, hey, this is, we all need help sometimes, and this help is available. And it's so amazing, this technique, because also it doesn't have negative side effects. Like so many other things that are used in the mental health world can have major side effects.
Major. And if there were a negative side effect in neurofeedback, it's often a very temporary worsening of symptoms. So, or fatigue, that tends to be a big one. But often that's because of an inexperience. Neurofeedback is a science and an art. And an art means experience, right? And I did my own podcast on why expert care is important. And, you go to experts like yourself and me, because we've been doing this a long time. And it's sort of, I had this situation, I don't know if this ever happened to you, Dr. Donnie, where, I had this air conditioner breakdown in my office building. And, this one person was like, here's the problem. And I was like, this is not the problem, because the bucket is underneath this other thing. And, this is the problem. So I brought people in, and finally I got this expert, and he's like, this is what the problem is. The problem is this, and that, He's like, these other people, they don't know what they're doing. He's like, I do this and whatever. And he was right. Like, that's what expert care gets you when you go to a place that really helps you align. But we do have to, take action, right? It's great to get information. It's so important, but you have to take one step. And for me, taking steps towards natural solutions are easy. And you just have to be consistent. And I think that's the harder part. We can try things, and, we have to, our nervous system in as little as 10 minutes a day can, powering down, doing things to regulate it, can have a real positive effect. And I feel like, okay, if my moms have 4 kids or 5 kids, you can squeeze out 10 minutes somewhere. Like, maybe that's before your feet touch the ground in the morning and you're doing breath work, and, maybe you're using biofeedback or PEMF or prayer, whatever it is. You have to calm that nervous system down. And as you so beautifully said, we do share our calm. It's called co-regulation. So it's actually that physical proximity right? And I always like to say, think of an anxious person right now. And you're like, oh, and you know what that's like, right? Somebody left me a message today, Dr. Donnie, somebody who's anxious, and it's a 10-minute message. And I was like, I'm not listening to it today because I'm not in the mood. It's not a client, somebody in a personal life. And I knew to protect my nervous system, right, from that. And there's just so many opportunities. I will listen to it, right? Somebody I care about. But there's so many opportunities I think we're just not reflecting on. And the more regulated we are, the better our kids are. And again, most importantly, they're realizing, wow, my mom takes care of herself, you know? And maybe
a powerful message, I think, for our kids so that they don't repeat our same patterns.
That's right.
They start to learn from a young age that it's okay to ask for help and that an expert, like you're saying, can offer tools that can make a big difference. And that's a way different message than, you have to do it all on your own and nothing's going to help. That just leads down toward a negative spiral, right? It's like just shifting that mindset.
Well, and if we're always in overdrive and our kids are always in overdrive, how are they going to feel in their body any different? How are they going to know when they're not at home with you and they're in college and, it's an uncomfortable situation and red alert should be going off, right? But it's not because it's always going off. So you don't have any danger signals. So, that may sound like an extreme example, but when you are in overdrive, everything registers and nothing important is being salient. So the more regulated you are, the more connected you are to your environment, the more you can say, oh, like somebody always says, like, I don't know what you feel like when you have something coming down, Dr. Donnie, but literally my bladder gets irritated. And I'm like, oh, something's coming.
That's your signal
today.
Know your own signals, right?
Know your own signals. And so by being regulated, you're much more able to tolerate stress, but also really be keenly aware in dangerous situations or when you're not feeling well, the things that can come through. And most importantly, your child can cope and take control. And those are the keys for lifelong mental health, having great coping skills. And we know that when people have a sense of control, that is what is tied to good mental health.
Yeah. Now, I know that you also are launching your new supplement line, which is for children, and it's just like the word fantastic, called Neurotastic, which is so awesome, and it's much needed because a lot of times when we then want to support children with their mental health or their health in general, like supplements, sometimes the supplement companies don't always offer great solutions for children. So I'm really excited about your supplement line. Maybe you can share a little bit about it with us.
Yeah, I'm so excited too. I've been working on this for a couple of years. And surprisingly, there really isn't a dedicated mental health supplement line for kids and families. And so, being that I have used supplements and why are supplements really important? So yes, diet is important. And I couldn't be a huger impact of having nutrient-dense foods, anti-inflammatory diet, which is the number one clinically proven mental health diet. And there are multiple types of anti-inflammatory diets. Mediterranean probably being the most studied, and also tied to longevity. But there are many kinds of anti-inflammatory, and they're all good, and you have to do what works best for you. But why I created this is there is a rise in genetic variants, a rise in stress, a rise in, neuroinflammation, and also viruses and infections impacting mental health. And people needed high quality, super tasty powder form, also clinical levels, researched clinical levels of nutrients to support the brain. And that's what Neurotastic is all about. And I started with magnesium because when you look at clinical research, right, it is the most used nutrient in the body. And it is clinically been shown to improve attention, stress levels, mood. I mean, on and on and on and on. And there's a whole list of physical things, and it really directly supports neurotransmitter functioning, heart health. I mean, just so many things.
It's
So
so true.
that
Magnesium is like, and it's so often we're deficient in magnesium without realizing it.
and stress is the biggest zapper of your magnesium levels. So, and I personally, my personal experience, and I have L-threonate, glycinate, and magnate in it, the three that are most researched for brain health, that when I take my magnesium, I feel calm within minutes, right? And I am a person that, like, I'm eating really clean. I'm taking care of myself. I drink a ton of water. That I notice the impact positively pretty quick. I am not the only one, but we need quick calmers, right? Our number one quickest calmer for our brain and body is breath work, and it's free.
Yeah, you can take a deep breath. That's the thing, right? We forget that we can just take deep breaths to calm our nervous system.
Yeah, absolutely. And prophylactically, if we do it multiple times throughout the day, it's going to help give us a regulation that's going to help us when we really actually need to be in fight, flight, or freeze, or even just an activation. So, our autonomic nervous system is supposed to activate when we have a real stressor, but the problem is it's thinking everything's a stressor. So this line of supplements, Neurotastic, is part of my mission to change the way we view and treat mental health and to offer quick, effective, science-backed solutions for kids and families. I mean, I that has been my life's work, and I am furthering that with Neurotastic. I also created a community called Calm Brain Community. It's a low-cost community. And anybody who does a subscribe and save gets a month in our community. And it's there as my community is all about teaching families how to naturally manage the brain, behavior, because, kids with neurodivergence, mental health problems are dramatically on the rise. And parents, we're not equipped to this. We don't know how to manage this. Nobody's taught this, right? And there are so many things that can give parents and kids a lifeline. And that's why, all of my work is really just to support those families. And even organizations. Organizations have so many more individuals with neurodivergence and individuals struggling with mental health. Like, the good news about the pandemic, in the sense that we are talking a lot more about mental health. I'm not so sure how much, Dr. Donnie, people are integrating these changes into their lives. So, I'm always the kicker in the tuchus for taking action is what, anybody who works with me one-on-one knows, like, hey, there's no magic wand. You are the magic wand. You got to take action.
I love that. Yeah, and it's so true. I'm sure those who are listening are getting a lot of information, and I'm hoping too, that message of just like, we're here, we're ready to help you, and just take that step to start getting help, because then from there, it can make such a difference. And it's like, you're never thinking, oh, I wish I would have waited longer. No, it's like,
no,
like, so glad I finally decided to get some help with this and really be able to create these changes. It's so true. And I'm glad you're mentioning neurodivergence, because I'm really wanting to increase awareness for that too, both in children and adults, to say, hey, we have such a diversity of nervous systems, and to not think that we all have one version of a nervous system or neuro functioning, and to have more awareness and acceptance for the diversity that can happen in the nervous system. And then for wherever your nervous system is, to know that there's help to, like, things like magnesium, which can sound so simple and too good to be true, but can make a huge difference when it comes to metabolizing adrenaline and helping with symptoms. And so I'm so
helping
grateful
with your menstrual cycle. I mean, there's just so many things, but, and that's where, I mean, again, for me, I chose this because it is the one nutrient what everybody said to me, I wish I started taking it sooner. And it becomes the gateway to realize, wait a second, let me make some changes. Let me get up 10 minutes earlier and, just do some stretches in the morning, or you do prayer, or, something that's going to create a balance in your life. And, and we just need wiggle room, right? I think we often feel like in our culture, if it's not right on the top of the summit, it's a failure. And, you have to get to the base camps. And we never appreciate the micro in our culture, which is part of why we're all so stressed out. So it can be a real celebration to just start at one point and get some wins. It's all about the micro. The magic is in the micro. So, and I love that you said that there's a range of divergent brains, right? And I think that's also a real stressor for our kids because we're trying to put them in that box. And we have to stop thinking about fixing, but really celebrating and optimizing. And it starts with a regulated, calm brain. I mean, and that's what we all need.
Oh, I love it. Oh my gosh. Thank you so much again for talking with me today and sharing all of this and everything that you do and create to put out there to help people. I'll make sure that there's links below this episode so people can find all of those resources that you've mentioned. And I look forward to staying in touch and hearing about the next thing that you are creating and offering for people to help calm their brain and help their health. So thank you again so much, Dr. Roseann.
Thank you so much.
You're welcome. And anyone listening, please make sure you subscribe and make sure you don't miss the next episode of How Humans Heal. I'll see you there.
Thanks for listening to How Humans Heal. If you liked this episode, leave a rating and a review. And for more resources, visit drdonnie.com.